I'd say it's a decrease in mood. So you see a lot of sadness and hopelessness. It's just a giant shift in a person's mood from a normal state where you have your ups and your downs to just being in a depressed or hopeless state for a long period of time. And it's almost like you're so hopeless that you can't pull yourself out of it. So I think for some youth, it's a little hard to tell whether I'm sad or whether I'm really depressed. A lot of research now is suggesting that there are neurochemicals, there's an imbalance in the brain. So for some people who may have used drugs or substances for a long period of time that messes with the brain chemistry, they can, even once they're clean, they can develop depression later on. Environmental factors can trigger depression. So there's this theory that it's using the biopsychosocial model, that it's due to biology, it's also due to the environment and due to interpersonal interactions and their own personality. So I think when you combine those 3 or 4 items, it can trigger a depressive mood or depression. Substance use. You may develop a substance use disorder to try and help yourself with your depression. I see a lot of that. Anxiety. Those two usually kind of go hand in hand a lot clinically. If they have bipolar, then they usually have like a major depressive episode as well as mania, so you can see it there. But yeah, I would say major depression and anxiety, typically I'll see those two often, and then substance use with major depression. And then I would say like significant chronic illness or medical diagnoses can sometimes trigger a major depressive episode, just trying to handle all of that. And then aging. You see a lot of depression in older, predominantly males, as they get above the age of 70. Cognitive behavioral therapy is probably the premier treatment used for depression. I personally like interpersonal psychotherapy, but that's usually when their depression is connected to interpersonal aspects, so their relationships with others is the major trigger there, or the major reason why their depression is maintained. And then medication. But to be honest, a lot of people don't want to take medication. Yeah. But when you explain that they may have a chemical imbalance, a neurochemical imbalance, and this is just to help adjust that, a lot of times they are more prone to try it. I mean, I think I would ask, what it is that I could do for you. Because if they're telling you, then maybe they're telling you because they need something, or they need you to, provide something. But I also don't want the teen to feel like they have to carry that friend. So if they are depressed and a parent or an adult doesn't know, then I would say you want to try and convince them to talk to someone who's older, or a guidance counselor or something like that in school. I mean, just being there and being a friend, and not saying, we'll be happy, or it's not really helpful. If they're already in treatment, just being there and being like, oh, I can tell you're really down today, what's going on, and just kind of being supportive for them. Because sometimes they really can't pull themselves out, and if they're in treatment, they're trying. And then just, letting them know that if it gets really significant, like to the point where you're thinking they may harm themselves or something like that, then letting them know, hey, I think we need to talk to an adult. Like, I'll go with you. Like, we can do this together. So just kind of, being there with them and allowing them to kind of express, what's going on today.